We will be discussing about the circulatory system. In this session we will be discussing about some introductory part of the circulatory system. All of us know that circulatory system, one of the major systems in the body, which carries blood from different parts of the body, and which it dissolves different substances and supplies to the different part of the body. So there will be a center part of the circulatory system, and the center part is called heart. So the function of the heart is like a pump. That is, heart has a job of pumping of all this around the body. Now once the heart pumps, the heart pumps the blood and substances around the body through tubes, some tubes. These tubes are called blood vessels. So we can see there is a central system called heart, and from the heart all this blood pumps into different blood vessels. Now this heart and the blood vessels together is known as a circulatory system. Now once we see the circulatory system, how it works, we can see circulatory system can be divided into two parts. That is a right side system, a left side system. It does not mean that right side system contain the deoxygenated system, that is deoxygenated blood, and left side system contain an oxygenated blood. It does not mean that the right side of the body contain only deoxygenated and left side contain only oxygenated. But we can divide it into a deoxygenated part and an oxygenated part, where the heart as the center pumping and the lungs also and the other body cells, we make it as two parts, that is a deoxygenated part and oxygenated part. Now once we see the regarding heart, it is the pumping, it is the motor of the circulatory system, and it's having 4 chambers. That is, upper side there are 2 atria, and lower side there are 2 ventricles. Then there are veins which brings the blood from the body. That is, deoxygenated blood from different parts of the body, these veins collects and it reaches the atria, except from the legs. And there are arteries which supplies the blood, that is oxygenated blood, which take the oxygenated blood from the body, from the heart, and supplies to the different part of the body. Now as heart is a pumping, it is a pump, but there should be some blood supply to the heart also. This is the coronary artery. You can see outside the heart there are coronary arteries which gives the blood supply to the heart itself. Now once we see inside the heart, so there are lots of valves we can see. There are 2 types of valves inside the heart. Along with that there are valves for these arteries are also there. So inside the heart there we can divide into atrium and ventricles, and we can see the veins from the upper side, artery from the lungs can be seen, arteries to the head and body can be seen, and veins from the lungs which reaches the left atria can be seen. And there are valves and right ventricles, left ventricles are also there. Now we'll see how the heart works. As in the step 1, once we see is as a sequence, one side from the left side, that is on one side it receives, the right side it receives blood from the body. At the same time the left side it receives the blood from the legs. In order to understand the work of heart very easily, that is, you can see, that is, first of all, the right atria receives blood, that is deoxygenated blood from various parts of the body. Now these deoxygenated connect in the right atria, and it passes to the right ventricle. Now from the right ventricle it goes to the lung. This deoxygenated goes to the lungs, and from the lungs it becomes oxygenated and it reaches again to the left atria. From the left atria it reaches to the left ventricle, and from the left ventricle this oxygenated blood pumps out through the aorta to the different part of the body. So that is the exact mechanism how the heart works, but it is not in that sequence. It occurs in the same step, that is like atrial motion at the same time and ventricular motion at the same time. So step 1 is blood from the different types of different part of the body receives the atria. At the same time, the left atria receives the blood from the lungs. Then the step 2 is atria, and then atria then contracts the valves and open to allow the blood to the ventricle. And in the step 3, the valves close and to stop the blood back to avoid the backflow. Then the ventricle contracts, and then the blood will be leaving the ventricle, and these cycles keep on repeating. Now, I told you heart is the major component of this circulatory system. So there are lots of blood vessels which passes this blood from the heart to the different parts of the body. Usually in the body there are 3 types of blood vessels can be seen. These are arteries, veins and capillaries. Now arteries are the blood vessels which carries blood away from the heart. That is, it contain always oxygenated blood which contain lots of oxygen, and it supplies to the different parts. Once we see the cross section of the artery, there are thick muscles and elastic fibers can be seen in the artery. So this elastic fibers allows the artery to stretch under pressure, and thick muscle can contract and push the blood along. So artery is the blood vessel which carries blood away from the heart. It contains oxygenated blood. The second type of blood vessel is the vein. Vein is the vessel which carries blood towards the heart. So once it carries towards the heart from the different part of the body, it contains lots of deoxygenated blood. That it contains the thin muscles, but it also contains the elastic fibers. And next thing is that vein is having walls, but artery does not have walls. So regurgitation, or the vein have walls which act as to stop the blood from going in a wrong direction. That is, regurgitation can be avoided by this presence of these walls. Now body muscles surround the vein so that when they contract to move the body, they also squeeze the vein and push the blood along the vessels. The third type of blood vessel is the capillaries. Capillaries, we can say it is an interconnection between the arteries and veins. It link between arteries and vein, and this is the position where the exchange of material between blood and other body cells occurs. So walls of the capillary is very thin, that is it's like only one cell thick, and the exchange of material between the blood and the body can occur through the capillaries. So capillaries is the link between the arteries and vein where the exchange of blood occurs, exchange of material occurs. Now once you see the capillary, once a collection of capillaries is there, this is called a capillary bed. There are lots of capillaries will be there, lots of body cells and artery and vein is there. This is called a capillary bed. Now regarding the blood, so circulatory system, it circulates blood to the different parts of the body. So there are lots of components in the blood. We will be discussing each component later. The major components of the blood are, there are blood vessels, red blood cells are there are white blood cells are there are digested food is there, platelets are there, oxygen is there in the blood, hemoglobin is there, carbon dioxide is there, plasma is there, hormones are there, oxygen, etc. Waste material like urea is also there in the blood. So especially the main components of the blood is plasma, then the blood vessel, the other cells like RBC is there, WBC is there, platelets is there. And once you see the RBC, this is one of the major components of the blood, one of the important component of the blood vessel. RBC is it's like a biconcave disc. That is, it's a biconcave disc, and there is no nucleus is there in the RBC. And RBC contain a special material called hemoglobin. The main work of the hemoglobin is it attaches to the oxygen and makes oxyhemoglobin and carry the oxygen to the different parts of the body and supply to the different parts of the body. Now, another important thing once we discuss about the red blood cell is that it can change the shape and it can skew and it passes through the capillaries. Next type of cells seen in the blood is the WBC or white blood cells. And when compared to the RBC, the main difference in the WBC is having a nucleus. It's having a big nucleus. And there are different types of cells is there in the WBC, and major type of cells are the lymphocytes and macrophages. Macrophages means it eat and digest the microorganism. So it as a part of this macrophages as a part of this that is microorganism, it eat and digest the microorganism. Now the lymphocytes, it is the fighters actually. These are the lymphocytes. The lymphocytes fight diseases by making antibodies, and it improves the immunities to destroy invader by dissolving them. Now other lymphocytes, some in lymphocytes make antitoxins to break down the poisons. Next type of component seen in the blood is plasma, platelets. Platelets are some cells, bit of cells broken off the larger cells. Platelets is the main component of the blood clot. It produces a tiny fibrinogen fibers to form a net, and this net trap other blood cells and form the blood clot. So platelets are the the main function of the platelet is the formation of the blood clot. Now once we keep the blood, the main part of the blood is plasma. Plasma is a straw colored liquid that carries the cells and the platelets, which helps to the blood clot. That is, plasma is it's the material which carry all these the cells like RBC, WBC, etc. Now this plasma also contains carbon dioxide is there, glucose is there, amino acids are there, proteins, minerals, vitamin, hormones, waste material also it carries. So that's about the brief description about the circulatory system. In this session we'll be discussing about the blood. It's more regarding its morphology, its function, which are the different components of the blood, and which are the different diseases which affects the blood. Now all of us know that is body contain approximately 4 to 5 liters of blood. That this 4 to 5 liters makes up around 8% of the body weight. Main functions of the blood is, the first one is it's having a transport function, then respiratory, then it maintains the body temperature, and blood is the one which controls the pH. It's having a nutritional, it helps in nutrition and excretory function also. It's having defense function. It is the blood, it is the one which regulates the body fluid and electrolytes. Now we'll go through each functions again. The first function we discuss is the transport. That is, blood transport different types of materials. It includes transport of hormones, that is from different area of production to the area of activation where it is activity, and drugs, that the medicines we are taking, it is transported to the where the activity occurs, that is drugs. Then dissolved gases like oxygen and carbon dioxide, and helps in respiratory procedures like oxygen can be taken from the lung to the different part of the body, and carbon dioxide from the different part of the body to the lungs. It is done, this transport is done by the blood. Now the waste products of metabolism like urea, water, etc. will be transported through the blood only. Now enzymes will be produced, some enzymes will be produced at one site, and its action, mechanism of its action will be another site. So this transport of the enzymes is done by the blood. Now next is the nutrient transport, that is just after absorption the nutrient is transferred to its separate different sites, is done by this blood itself. Now plasma proteins and the blood cells are also is there in the blood. This transport, the blood transport these plasma proteins and different blood cells to the various tissues. So the first important function of the blood is the transport itself. The second function is the respiratory function. The respiratory function of the blood is mainly due to the presence of a separate component called hemoglobin. That is, the hemoglobin is present in the red blood cells or RBC. The hemoglobin of the blood picks oxygen in the lung and makes it become the oxyhemoglobin. Then it circulate and discharge oxygen to the various tissues. And at the same time, it pick carbon dioxide from the different tissues and discharge into the blood. That is, it pick the carbon dioxide and become carboxyhemoglobin, and it is carried back to the lungs. Next function of the blood is the maintenance of body temperature. That is, all of us know that there is a large volume of blood. So the temperature can be circulated everywhere, so that the temperature, the heat can be absorbed and distribute all over the body. So like this they maintain the body temperature. Other than that, there are some hormones which regulate the hormones and enzymes which regulate the temperature. So the proper functioning of the hormones and enzymes, the production and its transport is done by after the production, it transport by the blood itself, and like this it maintains the body temperature. Next function is the control of pH or acidity level. That is, there are lots of hormones and enzymes are there in the body, but it work in an optimal pH or certain pH. That is, optimum pH is around 6.8 to 7.4 of the body. That is the optimum pH, and at this pH enzymes work properly. Now if the pH increases or decreases, it causes the destruction of the enzymes, and it causes the improper functioning of these enzymes. So in order to the controlling of the pH is very important. So in order for a proper work of these enzymes. So large amount of there are lots of acids are produced in the body. So next is there are lots of acids are produced in the body. As acids are produced, it may cause a change in the pH. So there are blood contain lots of buffers which decreases the pH or which makes the pH in an optimal level. And one thing is that blood contain buffers, and also this blood circulate this to different parts of the body, and thus helps in decreasing the acidity or decreasing the pH or keep the pH in an optimal level. So next, the important function is, another important function of the blood is the control of the pH. Next important function is the nutritional function. That is, after digestion there will be some end products. Digestion is done at the gastrointestinal tract, and there will be some end product. It is absorbed and transported into the liver, and then to the liver, and then to the different tissues through the blood only. So its absorption, its transport, for its absorption and transport, this blood helps. Next function is the excretory functions. That is, there are lots of, after this digestion, and there are lots of waste products, different activities also. There will be lots of waste products, and all these waste products are carried by the blood and removed from the body through kidneys. Then kidneys filter all these waste products from the blood, and toxins are removed from the blood by the kidneys and leave these toxins or whatever the waste product into the urine. So blood is having an excretory function is also. Next important function of the blood is the defense. The first thing is that WBC is the white blood cells are the main, these are the cells which work as a defense mechanism. That is, WBC act against invading bacteria and viruses. Lymphocytes, they make especially for the immunity, and plasma also contain lots of plasma carries antibodies. Now we'll go through what is the composition of blood. Blood, once we take the blood, it can be divided into two parts. A 55% of the blood contain plasma, and a 45% contain formed elements or blood cells. The blood cells or formed elements are usually three types of formed elements are there. These are erythrocytes, leukocytes and thrombocytes. Erythrocytes means red blood cells, leukocytes means white blood cells, and thrombocytes means platelets. So blood, it can be divided into two parts: plasma, which is the major component, and next is the blood cells itself, which contain RBC, WBC and platelets. Now the first component and the first important component is the erythrocytes or RBC. Usually the males is having around 4.5 to 6.3 millions of RBC per millimeter cube. In case of females, it is around 4.2 to 5.5 millions of RBC per millimeter cube. Now, lifespan of RBC is around 120 days. So, after this lifespan, and new cells will be manufactured at the bone marrow, especially bone marrow or myeloid tissues of the bones. And the removal of the dead cells, the dead RBC after the lifespan is done by liver and spleen. So, production is of the RBC from bone marrow and removal of RBC, the dead RBC, from the liver and spleen. Now once we go through the morphology of RBC we already discussed, it's a cell which does not have a nucleus. Its shape is circular biconcave structure with a diameter of 7.5 micrometer. So it is, once we compare with the human cells, it is much smaller than human cells. Now, cytoplasm is rich of hemoglobin. That is, we already discussed that what is the function of the hemoglobin. Hemoglobin binds the oxygen from the oxygen and supply to the different. And hemoglobin is responsible for the blood's red color. So, the RBC cytoplasm is contain lots of hemoglobin, and it is devoid of the nucleus, and its diameter is around 7.5 micrometer. And there is no mitochondria, there is no ribosome, there is no endoplasmic reticulum, there is no centrioles. So this is a morphology. Now, what is the function? What is the main function of this RBC? The main function of RBC is the respiratory. That is, it is due to the presence of a special material called hemoglobin. So all function is due to the presence of this hemoglobin. So hemoglobin, we already know that it picks and carries oxygen and carbon dioxide. So that's a function of RBC. Now we already discussed that the structure, the morphology, it is a biconcave structure. RBC's the structure is biconcave structure. There are lots of advantages because of this. The first thing is that as it is biconcave, it increases the surface area of RBC. So oxygen will get more area to diffuse, a bigger area for diffusion. So it increases because of this biconcave structure, and it's having the surface area has increased, so oxygen gets a bigger area for diffusion. Next is because oxygen does not have to travel a greater distance for diffusion because of this biconcavity. And because of the biconcavity, erythrocytes can easily skew through capillaries. And because it is biconcave, it is slim type of structure. Then spirocytosis, that is, these are the three advantages of biconcavity. The first one is it increases the surface area, and second one is that it does not have to travel, the oxygen does not have to travel a much distance for diffusion, and it can easily skew through capillaries. These are the three advantages of biconcavity. Now, if it loses its biconcavity, if the RBC loses its biconcavity, the condition is known as spirocytosis. We will be discussing it later again. Now, regarding the production of RBC, erythropoiesis is the term which is used for the production of RBC. We already discussed that RBC produced in the bone marrows, and it is after 120 days through the lungs and through the liver and spleen it gets destroyed. Now, erythropoiesis is the term which is used for the generation of erythrocytes. Now, at different stages, usually at different stages, the site of the RBC production varies of stages of that is life. That is, usually it starts at the third week of the intrauterine life and continues, the production of RBC continues till death. So, from the third week of intrauterine life till death, RBC production is there. Now, the the blood forming tissues can be classified into two. That is, the first type of tissue is the myeloid tissue. Myeloid tissue, and the second type of tissue is the lymphoid tissue. Myeloid tissue is seen at the red bone marrow. It produces RBC, granulocytes, monocytes, and platelets. So, blood forming tissue can be in the body can be divided into two: the myeloid tissue and the lymphoid tissue. Myeloid tissue, it is seen at the red bone marrow. It produces RBC, granulocytes, monocytes, and platelets. The second type of tissue is the lymphoid tissue. So, it includes the lymph node. It is seen in the lymph nodes, thymus, and spleen. Its main function is the lymphocytes, which helps in the immune mechanism. So, there are two types of tissues can be seen, that is for the blood forming tissues. That is, the first one is myeloid tissue and the second one is lymphoid tissue. Now, which are the sites of erythropoiesis? We already discussed that. From the third week of intrauterine life, the erythropoiesis starts, the production of RBC starts, and till the death, the RBC production is there. From the third week to third months, the RBC production is from the mesoderm of the yolk sac. After third month to the fifth month, the RBC production at the liver and spleen. After the fifth, that is from the fifth month onwards till the end of the life, the RBC production is at red bone marrow. So, after postnatal, at birth, all marrows can produce RBC. As the age advances, some red marrow will be converted into the yellow. After 20 years, only the flat bones, that is only the flat bones and upper end of the long bones, the bone marrow, red marrow, which is there in the flat bones, and upper end of the long bones can produce the RBC. Now, RBC is formed from derived from RBC, and all these cells are derived from a precursor cell called stem cells. These are all formed elements, including RBC, WBC, whatever the things. It is derived from a single population called stem cells. Now, the stem cells will be converted into proerythroblast, myeloblast, lymphoblast, monoblast, megakaryoblast, etc. So, once it is converted into proerythroblast, later it developed into red blood cells. Myeloblast, it developed into basophils, neutrophils, eosinophil, etc. Lymphoblast it later develop into the lymphocytes. Monoblast become monocytes, and megakaryoblast develop into platelets. So all these things are formed from the stem cells. Now, from the stem cells, once there is an all this is controlled by erythropoietin. So once there is decreased blood oxygen level, there is an increased erythropoietin, and it influence or it stimulate the red bone marrow, and there is an increased production of the red blood cells. So erythropoietin is the hormone which stimulate the RBC production. So once there is a decreased production of decreased blood oxygen, there is an increased erythropoietin, and the erythropoietin stimulate the red bone marrow, and there is more production of RBC, and there is an increased of blood oxygen level. Now RBC is produced, I already discussed, all these formed elements are produced from the stem cells. From the stem cells, RBC become the pro-erythroblast. Then it is converted into early erythroblast, then to intermediate erythroblast, to the late erythroblast, then reticulocytes. We will go through again that entire division. That is, first of all, there will be, you can see in the picture, there will be a stem cells, that is the precursor cell. Now, from the stem cells, there may be production of pro-erythroblast, it later leads to red blood cells. So, then there may be chance of production of myeloblast, there may be lymphoblast, there may be monoblast may be produced, there may be megakaryoblast may be produced. Now from the stem cells, if the pro-erythroblast is produced, it becomes early erythroblast, then intermediate erythroblast, then late erythroblast, then reticulocytes, then later it becomes the red blood cells. Up to the level of late erythroblast, you can see there is nucleus can be seen. There is a nucleus in the cells, and at the level of late erythroblast, nucleus will be extruded from the cells and become the reticulocytes and the red blood cells. So that is, you can see in that picture, in that diagram. Now stem cells may produce the myeloblast. Myeloblast become progranuloblast. Progranuloblast, again it become the basophilic myelomocytes. It become later leads to basophilic band cells, and later become the basophils. At the same time, myeloblast, it may produce progranulocytes and become eosinophilic myelocytes, and later it leads to eosinophilic band cells, and eosinophils will be produced. Now progranuloblast, again here again it may produce the neutrophilic myelocytes, and it become neutrophilic band cells, and neutrophils will be produced. All these three, basophils, eosinophil and neutrophils, are granulocytes. So these are their primitive cell is from the stem cells, myeloblast, then it produces progranulocytes. Now there are agranulocytes like lymphocytes, monocytes, etc. So from the stem cells there is production of the lymphoblast, and it become the monocytes, and monoblast it become monocytes. So these are the agranulocytes. So granulocytes and agranulocytes are produced from two different cells, but its precursor cell is the stem cells itself. Now for the production of platelets, there are megakaryoblast are there. Megakaryoblast will be converted into megakaryocytes, and megakaryocytes breaks up, and there is production of the platelets. So these are the different steps which causing the production of all these cells. Now we already discussed that erythropoiesis is the production of RBC. There are certain factors which support the production of erythropoiesis. The first one is a burst promoting activity, which helps the production of erythropoiesis. And we already discussed there is a hormone called erythropoietin, which causes the production of RBC. Then there are vitamins and folic acid which improves the, which leads to the more formation of RBC. Now next is ESR. All of us will be heard about ESR level, etc. Now what is this ESR? ESR means if we are keeping the blood suitably with adding suitably with anticoagulant. Otherwise the blood may get clotted. And if we are keeping the blood suitably with anticoagulant and allowed to stand vertically in a special tube called vestigial tube, the erythrocytes, because they have higher specific gravity than the plasma, begins to settle down, leaving two levels, that is settle down, leaving a clear upper plasma, that is upper level of plasma and lower level of cells. So this is the length of the plasma in millimeter after 1 hour. We can call it as erythrocyte sedimentation ratio, or ESR. So we are keeping the entire blood with adding anticoagulant in a vestigial tube, and we are keeping it for 1 hour to settle down, to 1 hour to sediment the cells, because this cells is having more specific gravity, higher specific gravity than plasma. So all these cells get settled down in the lower side of the tube, and this level of the plasma, the length of the plasma, then we calculate in millimeters, and this is known as ESR. So we know that it is a ESR value, it's a common hematology test, that is especially this in case of inflammation. In order to find out, it's a common hematology test, it is a non-specific measure of inflammation. Now ESR, it usually increases in pregnancy, or in case of rheumatoid arthritis or RA, ESR increases. Now there will be decreased ESR in polycythemia, sickle cell anemia, hereditary spherocytosis and congestive heart failure. And basal ESR is slightly higher in females. So how much is the ESR value? ESR value in males, it is less when compared to the females. Males, it is around 1 to 13 millimeter per hour. But in case of females, it is 1 to 20 millimeter per hour. So once we see the ESR value, there will be more ESR value can be seen in females, but it is less in males. So we were discussing about the RBC, and one of the we already discussed is that one of the major regarding the one of the major component, all the functions of RBC is due to the presence of hemoglobin. Now hemoglobin is a protein actually. It's a oxygen carrying protein present inside the RBC. Now its function we already discussed, it transport, that is transport of oxygen and carbon dioxide. Transport of oxygen from the lung to the different tissues, and transport of carbon dioxide from different tissues to the lungs. And it also behaves as a blood buffer. Now, there are lots of functions for RBC. Now, there is chance once the count of RBC may decreases. This condition is called anemia. So anemia is a condition where the erythrocyte count is less than the normal. So anemia, the cause of anemia may be different. It may be due to a blood loss. So it is usually seen in excessive menstruation, bleeding, peptic ulcers, piles, hookworm infestation, etc. We can see there will be anemia due to blood loss. In this case, bone marrow erythrogenesis may be stepped up, because of once there is a decreased level of RBC, the bone marrow erythrogenesis can be stepped up, but there won't be inefficient diet. There will be iron absorption may be less, or iron supply in the diet may be less, or it may be insufficient, again it leads to, there is chance of anemia. There is another type of anemia commonly seen is the iron deficiency anemia. Usually seen among the women at the reproductive age and also seen among the children. This is called iron deficiency anemia because at these ages there are lots of the iron is more required. So a deficiency of iron leads to iron deficiency anemia. Now there is another anemia called hemolytic anemia. This is due to excessive hemolysis, that is destruction of the blood cells. So it leads to again destruction of the RBC. So it causes a less number count of RBC in the blood and later leads to anemia. This is called hemolytic anemia. Now there may be usually this hemolytic anemia occurs due to hypersensitivity of any medicines. That is, as an adverse effect of hypersensitivity of any medicine, there may be chance of the hemolysis. Or any parasitic infestation like malaria, black water fever, or even a snake bite. A snake bite causes the destruction of the cells in the blood and later leads to a hemolysis. It leads to an hemolysis and later leads to an hemolytic anemia. Another type of anemia is aplastic anemia. We already discussed the RBC is produced from the bone marrow. So if the site, because of any reason, if the site of production, if there is some damage to the site of production, if the bone marrow may be depressed, so the production of the RBC also decreases. This is called aplastic anemia. Another type of anemia commonly seen is the sickle cell anemia. That is, it's a very severe form of anemia, especially seen among the African countries. And even it is seen among the Indian continents and Saudi Arabia and Mediterranean descent also this type of anemia. But it's commonly seen among the African heritage. Here, what is happening is that the shape of the hemoglobin changes. Hemoglobin form a long rod shape. The hemoglobin form a long rod which gives us the oxygen and stretching the red blood cells into an abnormal sickle shape. So sickle cell anemia, hemoglobin and the hemoglobin long rod shape, long rods, and the RBC become a sickle shape. That's why it is called sickle cell anemia. As the shape changes, so its function also decreases. It causes the decreased, it give up the oxygen. It cannot carry oxygen. So this condition is called sickle cell anemia. So it leads to the premature destruction of RBCs, low level of hemoglobin, and there will be pain as well as problem that can affect virtually to all the organs of the body. Now another type of disease commonly seen in the blood is the thalassemia. It's an inherited disorder. That is, this is a blood disorder passed down through families in which there is abnormal form of hemoglobin. That is, the disorder is there will be abnormal form of hemoglobin, and there will be excessive destruction of the red blood cells, and later it leads to an anemia. Next, another disorder commonly seen in the RBC is the hereditary spherocytosis. It is also called congenital spherocytic anemia. Here, there is a disorder of the surface layer membrane of the RBC. It leads to RBC that a shape like spear. That's why spherocytic. The shape of the RBC becomes spear and causes the breakdown or destruction of the cells, and this is also called this later leads to a hemolytic type of anemia. Now all these things what we discussed are the different types of anemia where there is a decrease in the RBC level. Sometimes there will be a chance of increase in the RBC level. RBC count and hemoglobin concentration can get increased, and this condition is known as polycythemia. Now the leukocytes. Next type of cells seen in the blood is the leukocytes or white blood cells. When compared to the amount of the red blood cells, there is then the amount of WBC is around 700 times. That is less. Cut. The next type of cell commonly seen in the blood is the WBC or leukocytes. When compared to the number of RBC, the number of leukocytes is less. So once we see the ratio between the two is around 1:700. So they are much less numerous than RBC. Now the difference from the RBC and the WBC is that RBC does not have a nucleus. At the development stage, it loses its nucleus, but WBC is having a nucleus. Then another important function, one important function of the WBC is it's the protective mechanism. It is the protective these are the protective cells that is participate in protecting the body from infection. Now RBC may be a granulocytes or a granulocytes. It consists of lymphocytes, monocytes with relatively a clear cytoplasm, and granulocytes which contain granules. So it may be a granulocytes or a granulocytes. A granulocytes contain lots of granules. Granules, and there may be a granulocytes. A granulocytes does not have a granule. It is having a clear cytoplasm. And granulocytes include the lymphocytes and monocytes. So what is the normal count? It is around 4,500 to 11,000 per cubic millimeter of blood is the normal count of WBC. Now WBC or white blood cells can be divided into two, that is granulocytes and agranulocytes. Granulocytes contain lots of granules, and a granulocyte does not have granules, so it's having a clear cytoplasm. Among the agranulocytes, there are two types of agranulocytes can be seen in the blood. That is, the first one is lymphocytes. It is around 20 to 25%, and the second one is monocytes. 3 to 8% is the monocytes. Again, the lymphocytes are T cells are there, B cells are there, NK cells are there. Granulocytes are the structures or the cells which contain granules. It may be there are three types of granulocytes are there. These are basophil, neutrophil, and eosinophil. Basophils reaches up to 1%, and neutrophils are the major granulocytes. This comes around 60 to 70%, and eosinophil is 2 to 4%. Now we will go through each cells. First of all, the lymphocytes. There are two types of lymphocytes are mainly seen. They are B lymphocytes and T lymphocytes. B lymphocytes are responsible for making of antibodies. T lymphocytes, again we can classify it into different categories, especially three types of T lymphocytes are seen in the body. They are inflammatory T cells, cytotoxic T cells, and helper T cells. Now the inflammatory T cells, its main function is it recruits the macrophages and neutrophils to the site of infection and other tissue damage. So once these inflammatory T cells are the T cells, these are the cells which for the recruitment of the macrophages and neutrophils to the site of infection. Then cytotoxic means that it kills the virus infected and tumor cells. And helper T cells enhance the production of antibodies by B cells. Next type of cells is the monocytes. Monocytes leave the blood and become the macrophages and dendritic cells. Macrophages, they are phagocytic cells, they are large cells, and it can engulf the foreign materials, antigens that enters the body. So these are the cells which engulf the foreign material and it engulfs the dead and dying cells of the body. Another type of cells usually seen is the neutrophil. Neutrophils are one of the abundant cells, most abundant cells of the WBC. And once you see the structure of the blood, once you see the hematology, you can see neutrophils are surrounded by red blood cells. A single neutrophils are surrounded by lots of red blood cells. Neutrophils squeeze through the capillary walls and into the infected tissue where they kill the invaders, especially the bacteria and viruses, and then engulf the phagocyte, then engulfs the remnant by phagocytosis. Next type of cells is the eosinophil. Eosinophil is, when compared to other tissue, other cells, the number of eosinophil is less low, but its amount increases in certain diseases, especially the parasitic worms. The number of eosinophil increases. These are cytotoxic, releasing content of the granules on the invaders. Next type of cell is the basophil. Again, during infection, the number of basophil also increases. Basophil leaves the blood and accumulate at the site of infection or inflammation, and they discharges the content to their granules, releasing variety of mediators like histamines, serotonin, prostaglandin, leukotriene, etc. This will helps in these are the mediators of inflammation. So once there is an increase in the blood flow to the area, and in other ways it add the inflammatory processes, the mediators are released by the basophils are also play an important part in some allergic responses, especially the histamines. So next type of cells seen in the blood is the platelets cut. So next type of cells commonly seen in the blood is the platelets. So platelets are small, regularly shaped. Just cut. The platelets are very small, regularly shaped clear cells, cell fragments. 2 to 3. Its size diameter is around 2 to 3 micrometer in diameter. And it is derived from the fragmentation of precursor called megakaryocytes. This megakaryocytes we already discussed. It is formed from the stem cells. Now its count is around 1.5 to 3.5 lakhs per microliter of the blood. Now we already discussed platelets are the smallest type of the blood cells. The main function of the platelet is the clotting activity, that is, it prevents the blood loss. So platelets can form a plug to seal the small vessels by themselves or start a clotting process. So main function of the platelet is help in the clotting. Like any other cells, it is also produced in the bone marrow, and its lifespan is around 5 to 9 days. Now, thrombocytopenia is a condition where the loss of platelets, or there is decrease in the number of platelets. So thrombocytopenia, once there is loss of platelet cells from circulation faster than the rate of production, so there will be it causes a decreased amount of platelets in the circulation. This is called thrombocytopenia. Now the cause may be two. Maybe either a decreased production or a failure of production or an increased removal. So first cause is the failure of production or a decreased production. For example, megakaryocytes we already discussed, from the stem cells megakaryocytes are produced. Now if the megakaryocytes are decreased in the bone marrow, these are the precursor cells due to any medicines. If you are taking a medication, and if the number of megakaryocytes decreases in the blood, this causes a decrease in the number of production of the platelets. And next one is an increased chance of there is an increased removal or destruction of the platelets, or increased removal of the platelets from the circulation. Maybe due to any disease, there is an increased removal of platelets. So this also causes the thrombocytopenia. Now next is coagulation. So we already discussed that platelets is the most important factor which helps in coagulation. Now coagulation can be classified into 3 stages. That is, first of all, there is activation of prothrombinase, then conversion of prothrombin into thrombin, and conversion of fibrinogen to fibrin. These are the main important stages of blood clotting or coagulation. There are 2 types of pathways of blood clotting. There is an intrinsic pathway and extrinsic pathway, and there are 3 stages. Main 3 stages are there: activation of prothrombinase, then conversion of prothrombin to thrombin, and conversion of fibrinogen to fibrin. Now there are certain coagulation factors. These are some factors which mediate the coagulation. These are fibrinogen factor 1. There are around 14 factors are there. 13 factors are there. The factor number 1 is known as fibrinogen. Factor number 2 is the prothrombin. Factor number 3 is the thromboplastin, and factor number 4 is the calcium. Factor number 5 is the pro-axillary. There is no factor number 6, and factor number 7 is the pro-convertin, and factor number 8 is the anti-hemophilic factor, and factor number 9 is the Christmas factor. Factor number 10 is the Stewart power factor. Factor number 11 is the plasma thromboplastin antecedent. Factor number 12 is the Hagman's factor, and factor number 13 is the fibrin stabilizing factor. These are the different coagulation factors. Now there are certain substances which prevents the coagulation. That is, it stops the blood from clotting. These are called anticoagulant. A substance which prevents coagulation is known as, it stops the blood from clotting, is known as anticoagulant. Now commonly there are there is a genetic disorder called hemophilia, where the person that there is ability to control blood clotting decreases. That condition is called hemophilia. So hemophilia is a group of hereditary genetic disorders that impairs the ability to control the blood clotting or coagulation. So it's also called a royal disease because it is seen in the royal family of England. So hemophilia is some group of genetic disorders which prevent the blood clotting. So there will be severe blood loss, and even it may cause the death of the person. So there are 2 types of hemophilia commonly seen: the hemophilia A and hemophilia B. Hemophilia A is due to the deficiency of the factor 7, and hemophilia B is the deficiency of factor 9. Next is purpura. Purpura is a condition where there is a purple or red discoloration on the skin. Now this may be due to a small bleeding inside underneath the skin. This is called purpura. Now bleeding time. Bleeding time is a common test used to find out how much time it takes for the clot. It's a measure of how quickly blood clots using the platelets, coagulating factors, and small vessel vasospasm. So that is the time of clotting, how much time it takes after an injury, after a small blood flow, how much time it takes for a clot. This is called bleeding time.